Navigating dementia care, it's one of the most significant challenges a family can face. And a huge, huge piece of that puzzle is figuring out the money. Specifically, what does Medicare actually cover? It's a really complex question, and the answers can be super confusing. So that's what we're here to do today. We're going to break it all down for you step by step.
All right, so let's just dive right in with the big one, right? The question that keeps so many families up at night. Does Medicare actually cover dementia care? I mean, you'd hope the answer is a simple yes or no, but, well, as you're about to see, it's a lot trickier than that.
And yeah, the honest-to-goodness answer is it's kind of both. See, Medicare does help pay for a lot of the medical stuff you need, but, and this is a huge but, it leaves some absolutely massive gaps in coverage. Gaps that can lead to staggering out-of-pocket costs. Understanding the difference between the yes and the no is, well, it's everything.
Okay, so to make this all make sense, here's the plan for our little journey today. We'll kick things off with the basic terms, then walk through care from the early days to the later stages. We'll even compare original Medicare with Advantage plans, point out exactly what Medicare won't cover, super important, and then wrap up with end-of-life care and what's coming down the pike. All right, first things first, let's get on the same page with the language. Because honestly, to get how your coverage works, you've got to speak the lingo. These next few terms, they're basically the foundation for everything you'll pay out of pocket.
Okay, first off, the premium. The easiest way to think about this, it's just like your Netflix subscription. It's that fixed amount you pay every single month just to keep the lights on, to keep your Medicare active.
All right, next we have the deductible. Think of it like this. It's the amount of money you have to spend on your own healthcare each year before Medicare even starts to chip in. It's like your annual cover charge to get into the club.
So, once you've paid that deductible, you're in. And that's when coinsurance kicks in. This isn't a set price, it's a percentage. The classic example is for most services under Part B, you'll pay 20% of the bill and Medicare picks up the other 80%.
And last but not least, you've got the copayment, or what we all just call a copay. This one's easy. It's a flat fee, a fixed dollar amount you pay for something specific, like seeing a doctor or most of the time getting your prescriptions. Like a $15 copay for a certain medicine.
Okay, so now that we've got the vocabulary down, let's see how this all plays out in the real world. We're going to look at how Medicare can actually help someone right from the very beginning, when those first concerns about dementia might be cropping up.
This is something a lot of people don't realize. Medicare's help can actually start before there's even a formal diagnosis. It all begins with this really important preventative tool, your annual wellness visit.
And hey, this isn't your average physical, okay? During this visit, your doctor is actively looking for any early signs that something might be off with your memory or thinking. And if they do notice something, they can put together a personalized plan to help support your brain health. That is a huge, proactive first step.
All right, so as dementia moves into its later stages, the kind of care a person needs, well, it obviously ramps up a lot. So let's dig into what Medicare covers when those needs become much more serious.
So a really big one is home health care, but, and this is key, there's a big string attached. The person has to be officially certified as homebound. If that box is checked, then original Medicare can step in and cover up to 35 hours a week of skilled care right there at home. It's an absolute lifeline for families, but you gotta know, it's not meant to be a permanent fix.
Now what happens when that home care just isn't cutting it anymore? Well, that's where a short-term stay in a skilled nursing facility, or an SNF, might come into play. And listen, the key word here is skilled. This is for medical care. We're talking physical therapy, wound care, that kind of thing. It's not for general, day-to-day personal help. Oh, and you almost always have to have been in the hospital for at least 3 days first to even qualify.
And this is where you really need to pay attention. Let's break down the costs. So, for the first 20 days, you're good. You pay $0. But then, from day 21 all the way to day 100, you're paying a daily copay. And it's not cheap. But here's the kicker. After day 100, you're on the hook for 100% of the cost. Everything. It's a total financial cliff, and it's something every single family needs to be planning for. Okay, this all leads us to a really big fork in the road for anyone on Medicare, and that's the choice between sticking with original Medicare or going with a Medicare Advantage plan. And trust me, the path you pick can make a huge difference in your coverage and what you end up paying.
Okay, so let's lay out the two main options here. With original Medicare, things are pretty straightforward. You can go to any doctor in the country that accepts it. Simple. Medicare Advantage plans, on the other hand, are a whole different ballgame. They're run by private insurance companies. They often roll in your prescription drug coverage, and they might throw in extras like vision or dental. The catch? you usually have to stick to their network of doctors. But here is a really, really important detail for dementia care. Some of these Advantage plans are called special needs plans, and they are designed specifically for people with conditions like dementia. That could be a real game changer.
All right, we need to talk. This next part might just be the most important thing we discussed today. We've spent a lot of time on what Medicare does cover, but now we have to get brutally honest about what it doesn't cover, because these are the gaps that can absolutely sink a family financially.
So let's just rip the Band-Aid off. Medicare will not, I repeat, will not pay for 24/7 care at home. It will not pay for long-term care in a nursing home or an assisted living facility. And it won't pay for what's known as custodial care. That's all the non-medical help, the day-to-day stuff like bathing, getting dressed, making meals, if that's the only kind of help a person needs. Honestly, this is the biggest myth about Medicare out there, and these are the expenses that can last for years and cost a fortune.
Okay, so as we look toward the final stages of the journey, the type of care needed really shifts. So let's talk about how Medicare steps in to provide support for end-of-life needs and also take a peek at some new things coming down the road. You know, after talking about all those gaps, there is one area where Medicare's coverage is actually fantastic, and that's hospice care. Once a doctor says that a person likely has 6 months or less to live, the Medicare hospice benefit takes over, and this is huge. It's not just about medical care, it covers pretty much everything: nursing, personal help, medications, even counseling for the family. The whole goal is just comfort and dignity.
And hey, looking ahead, there's actually a glimmer of hope on the horizon. There's a new pilot program called the Guide Model, and it's set to launch in 2025. The whole idea is to completely shake up how we handle dementia care, and, get this, how we support the caregivers.
I mean, look at the goals here. They're trying to tackle the exact problems we've been talking about. It's designed to finally give some real support to all those unpaid family caregivers out there, improve the quality of life for the person with dementia, and, this is the big one, help people stay safely in their own homes for as long as they possibly can.
And all of this leaves us with one last really big question. As more and more of us get older and the number of people living with dementia keeps rising, how are our support systems, especially Medicare, going to change to handle this incredible challenge? The answer to that question, well, it's going to affect millions and millions of families.